So what are you doing to honor Madiba's legacy today? The AIDS Healthcare Foundation is doing its bit in Besta near KwaMashu in Durban. It will provide fresh meals to the community at the Besta Clinic. The foundation will also give training in vegetable garden to sustain them for the long run. Well, eNCA reporter Lethiwe Mdluli is there and joins us now to take us through the day's activity. Lethiwe, good morning to you, colleague. How's it looking like in terms of observing Mandela Day today from where you are?
Well, good morning, Dumelo. This morning we are in Besta and we're joining the AIDS Healthcare Foundation for them giving back to the community. I know that today they will be providing meals to the community of Besta and also those people that are suffering from TB and also HIV. But to just give us more information about what they're going to be doing today, I'm now joined by Reshma Ramnandan, who's with the Healthcare Foundation. Reshma, thank you so much for joining us at eNCA. I want you just to take us through what are you doing to give back to the community for your 67 minutes on Mandela Day.
Thank you so much for joining us here. We are really pleased that you guys could attend as well. So AIDS Healthcare Foundation is an organization that's not new to South Africa. We have been in South Africa since 2012 and we are today supporting International Mandela Day as an extension of our Food for Health support. So take us a bit back. Food for Health is an initiative of AIDS Healthcare Foundation because the organization has identified that nutritional needs are also really relevant and important to have patients retained in care and to continue with their medication regimens. So Mandela Day for this year, which is 10 years since the passing of Madiba, has the legacy lives through us, right? And part of the objectives of the day or the statements of the day is that it's climate, it's food, and it's solidarity. So that aligns so well with us here at AHF and the Food for Health program. The Food for Health program was actually launched in South Africa last year, and so it's a program where we support food security. For 2023, we decided to adopt Besta's Clinic, which is like 5 km away from us, which is a municipality-supported facility. So during our support of community gardens, we've identified through the gardeners that there has been a soup kitchen, that excess of their, the yield of their crops will be donated to the soup kitchen. So AHF felt like, okay, this is a wonderful opportunity for us to also support the Besta's community and bring attention to our program and the needs of the community and the clinic. So in terms of what we are doing here today, so we are supporting the environment, the community with meals. So we are preparing fresh meals. Our staff is busy with the soup kitchen staff, and we're preparing something that's different to their normal menu. We've also identified, like I said, that through the humanitarian effort, one of the important factors to take home is that the nutritional support must be there for patients to take medication, because we want compliance, we want adherence, we want retention on care. So with our initiative for today, just to go back, so we are preparing meals for the community. We're also doing we've got an entire program lined up. So it's not only 67 minutes of support, it's 67 minutes throughout the day where we will be focusing on areas of climate change, food security, and the whole solidarity with the community. Besta's Clinic, has fallen victim to crime and criminal activity. So we want the community to also be aware, to bring home the message that, we love our community, we want to protect our community, and we want to support our clinic. Because we want to support patients who are unwell and make it, a safe place for them to come and access medication and healthcare. In our program today, we have multi-sectoral involvement. We've got eThekwini municipality, we've got the food security, we've got agro permaculture, we've got Department of Agriculture, food safety. We've got a whole host of colleagues who are joining us to share with the public, because Madiba also says if you power that knowledge is the most powerful agent of change, and that poverty or or charity is not supporting and alleviating poverty through this type of mechanism is not really charity. It's a means of justice. So AHF also supports justice and advocacy, and this is also food for health to ensure that we advocate for the rights of our patients, for our community. So we are also donating wonderful equipment that has been identified as needed by the community soup kitchen. This soup kitchen actually extends to the Kwamashu area, feeding 9 different areas. So we've got equipment, including there is like a chest freezer. There's also some groceries as well. Then as part of us saying thanks to our 9 ladies who are always here on time, feeding the community, to say thank you to them, we've got hampers, we've got food security demonstrations, as well as hampers for our community gardeners and our recipients of the soup kitchen, so they can take home, start a garden, and start their end to poverty.
That is so wonderful. But I also noticed that you have a tent where people are going to be testing for HIV as well. You're encouraging the community to come and test. You are in one of the provinces that has a high number of HIV patients or people who test HIV positive. In KwaZulu-Natal has been identified as one of those areas. What are you going to be doing to just make sure that people come and test, and that people actually are encouraged to do so normally and not just on Mandela Day only?
Absolutely. So we know knowledge is power. Knowing your status is power. Power so that you are able to receive health care. Previously in the past, we know, like in the 1990s, 2000s, access to medication, access to healthcare, especially people living with HIV, was quite a challenge. Now it is available. With the new 2023 change in antiretroviral therapy, being on antiretroviral medication is so simple. It's just 1 a day as opposed to previously 13 days a day. So to bring us back to our tent in terms of our counseling and testing, so health services counseling, HIV counseling and testing, we do have AIDS Healthcare Foundation staff who are available to the community for testing. We can do, it's universal test and treat. We're going to same day start on medication. So it's important for us to also encourage communities to share the information and to remove the stigma. HIV is just another chronic disease in South Africa. We need to know our status in order to access healthcare, to reduce the opportunistic infections that can threaten the quality of life, as well as the quantity and length of life. HIV, I think the message is most important is that if we know, we treat. If we treat, we improve the quality and quantity of life. Yeah.
Thank you so much.
Thank you so much.
Well, Dumelo, there you have it. The AIDS Healthcare Foundation is in Kwamashu at Besta to just basically encourage the community to test, but also to help them out with meals and upskill them when it comes to gardening so that they can carry on this legacy. We will obviously be spending the day with them and just talking to the community as well, finding out what they will be doing to take part in their 67 minutes.
Absolutely, Lethiwe. Such a strong and important message that we know was very close as well to Dr. Madiba's heart. The message around awareness when it comes to HIV and AIDS, but also how one can protect themselves but keep themselves healthy once they've also been diagnosed with HIV, because it is not a death sentence. Quite a strong and important work that we're doing and seeing there in Kwamashu. But we'll be sure to catch up with you again, colleague, as soon as there are any other developments, as we of course continue to show you what South Africans as well as other parts of the world are doing in commemoration of Mandela Day today.